Namaskar, this is Dr. Munjal Thakar. Today I share a very interesting case with all of you of an autistic child. This child was diagnosed with autism at the age of 2.5 years. After giving MMR vaccine, the patient's parents noticed that he had completely stopped talking. Before the vaccination, the child was talking well, mixing with everyone, but after the second shot of MMR, the child had completely stopped talking and completely making eye contact. They had tried several treatments and this child was brought to me, and today in the morning I see this child and I find something very unique about this child. This child was able to recognize languages. He could read languages like Urdu, Punjabi, Telugu without receiving any formal training to learn these languages. This child would learn very quickly whatever was taught to him, but this child, once he had lost his speech, there was nothing that could bring back his speech after so many years of speech therapy, so many years of occupational therapy, even giving him other allopathic medications. And this, for me, was the very entry point in the case. Normally, if the child is intellectually disabled, the speech will not develop, because development of speech requires a certain amount of intellectual, cognitive abilities, because speech is a very complex phenomenon. Lot of processing of the languages happen in the brain before the speech is achieved. But in this child, what we find is his cognition seems to be excellent, especially for these languages and otherwise also. Such kind of children who have one isolated area of the brain very superiorly developed compared to the rest of the peers of that age are called autistic savants. They are gifted with certain abilities which others don't have. For a homeopath, this would become sometimes a very peculiar entry point, individualizing point into the case. And this child, when I was going through the repertory, I found this very intriguing rubric under the section mouth. I will read that out from synthesis repertory. It says under the rubric mouth, speech wanting but intelligence unimpaired. This is the combination that I was actually looking for. The only remedy is Kali cyanatum. There were very interesting features in this child which made me think of giving Kali cyanatum to this child. I will share these two very important features. Is intense restlessness in this child. The mother says with several therapies a lot of things have improved except this intense restlessness, and he needs to be constantly in motion, maybe in the bus, maybe in the car, and then he's quiet. And he has this constant involuntary movement of the hand, the flapping of the hand. which is almost non-stop. She says, even I find in sleep, his fingers will flicker. And the other interesting thing that she told me is that he gets very cold sweat, profuse cold sweat. And I was just looking up this remedy Kali cynatum, and I found that in the cyanide group, the restlessness is quite characteristic. And this involuntary movement of hands, which one can translate as restless hand, is covered by the remedy hydrocyanic acid. There are several cyanide remedies when it comes to perspiration. And Kali cynatum, which is potassium cyanide, covers this remedy cold clammy sweat. On these grounds, I happen to prescribe this very rare, ill understood remedy called Kali cynatum. This addition of speech being lost but the intelligence remains unimpaired is the addition from Phatak, and you will find this in the Phatak materia medica also. Most of the time we know Kali cynatum as a cancer remedy for the cancer of the tongue, but I believe that if we understand the cyanide group of remedies, there is much more to understand. So let us see how this child will do on this remedy. But I had to share this interesting aspect of Kali cynatum and the interesting aspect of autistic savants, which can be a key individualizing feature for a homeopath. So keep looking in the history of autistic children. There is a very small percentage of autistic children who have these islands of intelligence. So happy learning. Keep watching. Do share and like this video. Wait for many more to come.